Thank you guys so much for joining us. I'm Lauren Berman. I'm a pediatric surgeon in Wilmington, Delaware at Nemours, and the chair of the Quality and Safety Committee. So have been involved in the effort of APSA to kind of gather and share knowledge around COVID-19 and how we're all coping. So this call was done about a week ago with a different group of people, and we've convened this current group, people from a combination of practice settings and COVID intense areas. We thought we would maybe just start by having everyone just briefly introduce yourself, where you work, what kind of a practice setting it is, and also kind of what the local COVID burden is like in terms of both the pediatric and adult impact locally for you. If we want to just go around, we can start with Marilyn.
Hi, I'm Marilyn Butler. I'm a pediatric surgeon in Portland, Oregon. And I checked the website that estimates when peaks are going to be. And I think our peak is now moving to May 1st. As a result, we've only had about, I think, 16 or 20 deaths and a concomitant number of positive tests. Very little impact on pediatric surgery life at all, other than we've canceled all elective surgery and moved everything virtually, both clinics and educational conferences.
Thank you. David Mooney, you want to go next?
I'm Dave Mooney. I'm a surgeon at Boston Children's, and we're still on the major uptick for COVID cases, but it's been predominantly adults. We've had around 30 staff members test positive. One of a surgeon at our institution tested positive, was in the ICU for a time, but is now back out and is recovery phase. Same, we're not doing much. We've canceled all emergency surgeries. The only people in the building, they're telling us not to go to the hospital unless you're either the person on call that day or you're the rounder. All conferences, even residents are being put in the building if they have cases to do. Other than that, the residents aren't in the building. We're just trying to minimize the number of people. If you go in the building, you wear a mask. They hand you a mask, they check you, do a quick screening for a fever at the door, and they give you a mask. And I'm doing telemedicine visits, stacking up kids with hernias to be done once this is resolved.
Tony, you want to go next?
Sure. Thanks for having me. I am a pediatric surgeon. My name is Tony Escobar. I'm a pediatric surgeon at Mary Bridge Children's Hospital in Tacoma, Washington. Things here in Washington State have been pretty significant, as you probably have seen on the news. Our last numbers that I can quote are near 6,000 cases in Washington State with almost 250 deaths, but the pediatric population has not been hit hard at all. The work environment, or my hospital, is a children's hospital within a hospital. And so we are working very hard to accommodate the anticipated surge, which as of yesterday was going to be April 15th or 16th for us. And so working on expanding the age limits of who we take, how are we going to be able to support our adult colleagues, because I know you may be aware that Seattle and King County have been hit extremely hard, and we're to the south in Pierce County, and we've been hit very hard as well. So that's kind of where we are. We have canceled all elective cases. PPE conservation has been a huge push, and still trying to figure out how we're sharing the ORs with the adults and how do we protect ourselves when we do operate. So it's kind of the lay of the land here.
Okay. Thanks, Tony. Art Cooper, why don't you go next?
Sure. Thanks for asking me to participate. My name is Art Cooper. I'm a pediatric surgeon in a municipal hospital in New York City, Harlem Hospital. Specifically, we also cover Metropolitan Hospital, another city hospital within New York City. As all of you are aware, New York City is now the epicenter of the epidemic in the United States. As of earlier today, Governor Cuomo reported over 3,000 deaths, and In the city, we have 53,000 cases and over 1,500 deaths as of 3 hours ago, according to the latest media reports. Harlem Hospital and Metropolitan Hospital have not been hit hard with respect to pediatric cases. However, Harlem has been very hit hard with adult cases. 2 other hospitals within our system, Elmhurst Hospital and Lincoln Hospital, as many of you may have heard, have been overwhelmed. They've both been on the national news. The trauma centers at Elmhurst and Lincoln have either essentially shut down or are able to really respond only with the minimal capability. Here at Harlem, we've had over 50 deaths over the past week or two. The staff have been extensively redeployed. Virtually every unit has been taken over by COVID patients, including our pediatric unit, which has been turned over completely to our adult colleagues. We have been relocated to another space where we have just a few pediatric beds and just a few pediatric critical care beds available to us. As a pediatric surgeon who has had very, very limited work to do, even on an emergent basis, of course, none on an elective basis, I personally have been assigned to what we call our ILI unit, our influenza-like illness clinic, where patients who are essentially worried well or walking wounded, so to speak, are coming for testing. I do that about once a week, along with all the other surgical attendings in our hospital, of course, with appropriate PPE and so on. But it's an interesting time for all of us.